Water is the baseline of human existence. Every biological function we have depends on securing a reliable, daily supply of it. In many parts of the world, accessing this supply is a highly social act. Entire neighborhoods are connected by the shared infrastructure of a communal tap, making it a daily gathering point for families. But this shared dependency introduces a critical risk. The line between a life-sustaining resource and a vector for disease depends entirely on a fragile network of sanitation barriers. When those physical and chemical barriers break down, the water grid that binds a community together rapidly accelerates a public health crisis. This is Vibrio cholerae, the rod-shaped bacterium responsible for one of humanity's oldest waterborne threats. Cholera and acute watery diarrhea are ancient infections. Today, they thrive by exploiting gaps in modern sanitation, appearing wherever untreated human waste intersects with drinking water. Once consumed, the bacteria travel to the gut and bind to the intestinal walls. They release a toxin that forces the body to secrete massive amounts of water and electrolytes, leading to severe dehydration within hours. A local outbreak is a biological reality, yet its presence signals a much larger failure, the collapse of a region's sanitary infrastructure. The breakdown of clean water systems rarely happens in a vacuum. It is usually the downstream effect of broader geopolitical or environmental crises. Extreme weather and natural hazards frequently wipe out existing water grids. When severe flooding isolates rural communities, the stagnant surface water creates the ideal transmission environment for the pathogen. Armed conflict and mass displacement produce similar outcomes. The sudden, dense concentration of people in temporary settlements often outpaces the capacity to provide safe water, while simultaneously delaying access to medical treatment. The collision of climate instability and forced human migration produces a volatile landscape where multi-country outbreaks are increasingly difficult to control. The World Health Organization's epidemiological update for May 2026 illustrates the massive scale of this problem. In that month alone, 29,610 new cases were recorded across 16 countries. This heat map shows case distribution per 100,000 population. The Eastern Mediterranean region reported the highest raw count, over 15,000 infections. However, the African region suffered the highest human cost, recording 201 cholera-related deaths during that same window. This data table breaks down regional shifts. Myanmar experienced a massive surge, with cases jumping 980%. Conversely, Haiti reported an 89% decrease in new cases, highlighting the erratic global shifts of the disease. This stacked bar chart maps the timeline of cases since 2024. The pronounced peaks and valleys show how cholera moves in massive, repeating waves, surging and receding across different regions over time. These rolling waves of infection represent a globally interconnected vulnerability that requires a coordinated, cross-border response, rather than isolated local fixes. Inside frontline clinics, medical workers are fighting the severe dehydration caused by the pathogen in a direct race against the clock. The immediate countermeasure is oral rehydration therapy. A precise mixture of clean water, sugar, and salts replaces the vital fluids the body is rapidly losing. For more severe cases, doctors rely on intravenous fluids and targeted antibiotics, while oral cholera vaccines are deployed to build immunity in the surrounding population. Left unchecked, the disease is highly lethal, but with timely access to basic medical care, it is entirely treatable. Defeating the disease also requires anticipating where it will strike next. At the World Health Organization headquarters, global health teams monitor an invisible, digital front line. Through a system called Digital Event-Based Surveillance, analysts track early warning signs of public health threats globally before they peak. The scale of this tracking is immense. In just 1 week in June 2026, the system scanned approximately 760,000 raw signals, filtering them down to identify just 19 events requiring immediate operational attention. This data directly guides the physical response on the ground, directing resources to build resilient infrastructure, like secure water storage, in the most vulnerable areas. Outsmarting the bacteria requires both sides of this equation, the high-altitude perspective of global surveillance and the grounded physical engineering of local communities. The persistent return of cholera points to severe gaps in our infrastructure, but it remains a highly preventable infection. Despite the geographic complexities and localized surges in 2026, overall global cases actually dropped by 59% compared to the same period the previous year. The data proves that these interventions work. Through vigilant scientific surveillance, immediate medical care, and a commitment to providing secure drinking water, we have the tools to make this ancient disease a relic of the past.